everyone. I'm Gary Null. I'd like to welcome you to a special presentation of the Progressive Commentary Hour. Today, we are looking back and asking a series of questions. Did we in actuality have a worldwide pandemic caused by a SARS-2 virus? If so, why were we told as a public not to do anything, stay at home, stay away from people, wear masks, social distancing was required? But more importantly, to the physicians in the United States, they were told, stand down. There is no effective treatment at this time. We are working on vaccines. We have a very fast process of bringing them to your attention. And when we do, they'll be safe and effective, guaranteed, because we have the best minds in the world working on it. We also told physician, though you have a lot of experience in internal medicine in your specialty, infectious disease, emergency room medicine, do not treat any of the symptoms. In fact, the only drug that we're promoting at this time, if when a person is too sick to stay at home, is remdesivir. And it's been tested and shown to be not just safe, but very effective. And it's Anthony Fauci's drug of choice. All right? And people obeyed. Probably 99% of physicians, pharmacists, nurses, and public health officials all began to get on board. 70% of the American population also said, I'm a good citizen, tell me what to do, and I'll do it. Well, first of all, your kids out there playing soccer, he's got to wear a mask. Okay. You're kayaking in the Pacific Ocean and the Golden Gate Bridge, wear a mask. You're going swimming by yourself in Bermuda at the beach, wear a mask. When you go in to shop, look at the circles. They're 6 feet apart. There's science behind that. Trust us, we know best. And the majority of good citizens, that includes good physicians who follow protocols, all obeyed. For the first time in world history, we have more articles published in peer-reviewed journals being retracted than ever before. In a good year, you might have 20. We're having thousands. Why? Why, if they were so certain and the board peer review system was so good, why are they now saying, hold on a second, we're erasing everything that we told you. You can't find anything on our website. Why is it that the people who headed the CDC, the FDA, U.S. Public Health Service, the top officials in government told us to trust them, and we did, and now we're finding out they lied. Everything we were told, it turns out, was not true. One example before we go to our guest is that when we went up on the government's own site and looked under remdesivir, indeed there were 4 trials in Africa, but for not the COVID virus. And the death rate was 54%. They had to stop the study, the 4 studies. Why weren't we told that? Why wasn't that drug banned? But it wasn't. We had successful treatments. On this program, the very day that we were told that we had this problem, I wrote an article only using data from the National Library of Medicine's peer review system. And I said, for the symptoms, which is a severe flu of this virus, here's what you do to protect your body. And there was ivermectin, hydroxychloroquine, vitamin C drips at 25,000 milligrams. There was zinc, vitamin A at higher doses, 50,000 units. There was omega-3 fatty acids. There were herbs like pau d'arco, bee propolis. There were a whole group of things you could do, foods you could eat, juices you could take. And historically, they had the evidence that they could fight not just viruses in general. And by the way, it was the Ebola virus that remdesivir was tested on. But now you could stay healthy. So when we were all expected to get the virus, just like in a schoolroom, not every student and teacher gets sick. Some will, some won't, depending upon the immune system. and what they do. So we had good quality science in the peer-reviewed literature that was there to help us. And this is the government's own repository for what is considered unimpeachable evidence. I then wrote a second article. The second article, about a week later, was what lifestyle changes could we make that could help us, our overall immune system. I did a whole tutorial on the immune system, the innate immune system and the adaptive immune system. And if we were told do nothing, and yet we were in conditions such as lockdowns, not available for fresh food, not getting out, exercising, the very things we needed to do, they told us not to do. The very thing that physicians could have done, help with the knowledge they have historically, helping with the flu, they were told don't. Now, normally in a good society, a fair society, everyone who is qualified has an opportunity to share their points of view. That was suspended. Your freedom of speech on this issue was negated. And a massive campaign led by the White House and later by the pharmaceutical industry met with Mark Zuckerberg and said, you cannot have anyone on this list give advice. Here's where you get your advice. And they obeyed. They even set up a special censorship board. And that censorship board was a disinformation agency of the federal government. And all they did was give us misinformation. Accurate information was suppressed. But not since McCarthyism were you gone after an attack simply for suggesting that there would be a different approach to this condition. And everyone was destroyed. Everyone who would later be found to be telling the truth. That's my introduction to today's program. My guest to take us on this journey is Dr. Mary Talley, that's T-A-L-L-E-Y, Bowden, B-O-W-W-E-N. She is a board-certified physician, has had no historical problems whatsoever. In fact, she's been acknowledged for not just being a good orthodox physician, but she's also open to complementary approaches that are more natural, non-toxic, supplementing that with her knowledge of allergies and sleep medicines to get the best of both, or whichever works best, her patients benefit. She's the founder of the Breath MD in Houston, Texas. And during the pandemic in 1921, she had her medical privileges suspended by the prestigious Houston Methodist Hospital. That was followed by her resignation. Why? For her courage advocating for early treatment against SARS-2 infections and her criticisms of COVID vaccine mandates. This was despite her success in treating thousands of COVID patients with ivermectin and monoclonal antibodies. Dr. Bowden is today one of the leading physicians trying to stop COVID shots and exposing the failure of our public health system. She's taken legal action against the Texas Medical Board on charges of censorship and has been recognized by the Texas State Legislature for defending patient rights. She is the founder of the Americans for Health Freedom, a grassroots coalition of over 1,300 health organizations, and she's on the board of the Vaccine Safety Research Foundation. She's a graduate of the University of North Carolina. She received her medical degree summa cum laude from the Medical College of Georgia and later specialized in the sleep medicine at Stanford University Medical School. Her website is breathmd.org. And before I say welcome to the program, something just came to my mind. Back in the 1970s, there were 5 physician scientists in the United States who seemingly had extremely good results with cancers, especially terminal cancers, whether it was pancreatic cancer, breast cancer, glioblastomas, astrocytomas, it didn't matter. I became interested in this and I went to their clinics. I interviewed over 1,000 patients. One was in Germany, Dr. Joseph Issels. In the Bahamas, Dr. Lawrence Burton, Dr. Virginia Livingston Wheeler in San Diego, Dr. Emmanuel Revisi in New York. And then in Houston, Texas was a Dr. Stanislav Brzezinski. He was an MD, PhD. His funding came from the Damon Runyon Fund and the US government. He had published hundreds of articles in peer-reviewed literature. And I'd gotten a call saying that the Texas Medical Board, the very same medical institution that was researching into my guest, and that they were going to go after him. He had been doing work on the body's own natural antibodies and how to reconfigure them. And so I went to the American Cancer Society's recommended person for the Unproven Methods of Cancer Management list. And I sat with him and I said, here are 5 doctors. Show me what makes them a quack. Show me what makes them a person you disdained and want all funding and removed and all honors removed and invited nowhere. You want to excommunicate these from the Church of Orthodox Medicine. Show me the evidence. He had none. Have you visited this center? No. Have you ever interviewed the doctors? No. Have you ever interviewed the cancer patients who came in being treated at MD Anderson and Sloan Kettering and Roswell Park and Mayo Clinic? Didn't succeed, went to these people and they helped them. And 5 years later, they have no cancer. No. Not one? No. Then where's your information? These people are doing something wrong. He had no answer. So I went down and I challenged the state medical board in Texas. And I grilled them. And I said, you're going on a fishing expedition into Dr. Brzezinski's office without any probable cause, with no notification to him. You show up when you want, you go through his patient's files without first getting a court order, looking for something he's done wrong. So you can then take away his medical license. That's what they were trying to do. So after I went after them, the state medical board, and I believe all state medical boards should be abolished because they're all political, they backed off. I wrote an article. It was a cover story in a major national magazine. Judy Moses of 2020 contacted me, said, this is a phenomenal article, and you saved a doctor's career and the patient's lives because he has so much success. They did a special in 2020, won 2 Emmys. And for the next 4 or 5 years, he was left alone. Then when everything calmed down, they went after him again. He's still practicing, by the way. I just want to give that as just a little insight. So welcome to our program.
Thanks for having me, Gary. That's a very interesting story. I had no idea you had that connection, Dr. Brzezinski.
Would you please take us on your journey, like a classroom on the air, starting with you're being challenged by the Houston Medical Hospital and the state boards, and how they had no proof you had injured a patient, but you had a lot of proof you were helping patients. Excuse me. Tell us your story. There's no rushing. We're non-commercial. Take your time, and the forum is yours.
Well, thank you. I'm an ear, nose, and throat doctor, and prior to the pandemic, I had a very quiet solo practice. I actually had taken several years off because I had 4 boys in 5 years and took time off from medicine. And then I went back to medicine 6 months before the pandemic started. And when I went back, I decided I was going to do things a little bit differently and be very independent and not contract with hospitals, insurance companies, or the government. So my practice, I call it third party free. And the only people I work for are my patients. And that actually served me well during the pandemic. And because I'm ear, nose, and throat, I see a lot of respiratory tract infections. And when the pandemic started, I had people asking me, okay, how can we get tested? I had people coming in sick. I started off using the LabCorp was the first lab to have the COVID test, but they became completely inundated and it was taking 2 weeks to get results back. So I'd already been using a lab called Microgen DX, which does PCR testing for patients with chronic sinusitis for bacteria and fungi. And they came out with a PCR saliva test for COVID. And so my little clinic exploded because I started using this test, and we were able to get the results back the next day. And it was really the only alternative to LabCorp, which was a swab up the nose, and it would take you 2 weeks to get the results back. So that's how it sort of started. And at the beginning, I tried using hydroxychloroquine. The Texas State Board of Pharmacy actually shut us down. We were prohibited from prescribing hydroxychloroquine. And that was illegal. It was just a done executive order. So I put it on the back burner, and I didn't get the news that we were allowed to use it for quite some time. But I did my best using breathing treatments. I would use antibiotics for secondary infection. Initially, I didn't have a lot of demand for people wanting to get treated. But then when monoclonal antibodies came, I started offering those, and those worked really well. I could get unlimited supply. I would get them quickly. And again, my clinic became known in town as a place where you get monoclonal antibodies because we didn't ration them. We didn't, say, oh, you have to be a certain age or a certain race or have certain comorbidities. We basically just come one, come all. And we did not charge excessive amounts for them. It was about $175 to cover supplies and staff. And so we became known as a place to go for monoclonals. But then, the government started rationing them. The government took over the distribution of monoclonal antibodies, and they became harder and harder to get. And so that's when I turned to ivermectin, and sometimes in combination with other medications. And I was actually worried because monoclonal antibodies seemed to work so well. I didn't think that ivermectin was going to live up to the hype. But I did find that I was able to keep people out of the hospital even without the monoclonal antibodies. And I ended up treating over 6,000 COVID patients, and everybody that got early treatment stayed out of the hospital and survived. I also had a handful of patients who were super sick who came in the second week of illness with extremely low oxygen saturation, something I had never seen before, in the 60s. And they just refused to go to the hospital. So I just did my best. And you basically have to allow them to possibly die in our clinic, which is really scary. But they made it, and that was very encouraging and rewarding. But so the other component to this, that being said, I was a very small clinic, and no one, I don't think any would have bothered me at all. But for the fact that I stepped on the toes of Houston Methodist Hospital. I had privileges there. They were very loose. I never stepped foot in that hospital. I just had them in case one of my patients needed to be admitted to the hospital. And I actually had a collegial relationship with them. I was doing research because I had so much data from testing. We were collaborating, and they were going to help me publish my data, just looking at ear, nose, and throat symptoms in patients with COVID. But when the shots came out, because I was doing so much testing, I quickly realized that the shots weren't working. And I brought that to their attention, and I said, hey, are you seeing what I'm seeing? I'm seeing all these breakthrough cases. What's the word at Methodist Hospital? Thinking I would get a straightforward response, but instead they just glossed over it and basically said, well, we think that the shots are going to just lower severity. And that was really the last communication I had with them until I got a text message in mid-November 2021 from a reporter at the Houston Chronicle asking me to verify, is it true that my privileges had been suspended at Houston Methodist Hospital? And I did a double take. It's like, I don't know what you're talking about. Check your sources. And then I go to my email, and they had suspended my privileges. Then on Twitter, they announced it to the world that I was spreading dangerous misinformation not based on science. And what really triggered that is I had a culmination of events occur on one day that prompted me to send an email to my patients. And the events that occurred, I had a surgery center say that I had to get the shot to operate there. I had a patient call me who was very distraught. She had a history of bladder cancer, and she told me that her urologist at Houston Methodist Hospital had called her and said she will probably need to find another urologist if she decides not to get the COVID shot. And then I had a battle going on with a hospitalized patient who had been on a ventilator for a month, and his wife wanted him to try ivermectin. They had tried everything else, and the hospital refused. So she sued the hospital. This was Texas Hughley Hospital in Fort Worth. And I was part of that lawsuit. So I was an expert witness. I testified. And then I was also the doctor that was going to be prescribing the ivermectin. So the wife won the lawsuit, and the court ordered the hospital, Texas Hughley Hospital, to grant me emergency temporary privileges. And at this time, privileges are usually an arduous process. It takes a long time. You have to gather all sorts of information. But during the pandemic, they waived that process. It was a same-day process because they were in such need of physicians. But in my situation, they ignored the court order. They made me go through all sorts of hoops to get the privileges. I had to submit my surgical caseload. I had to get letters of recommendation. And I did all that. And then they said, oh, we're denying your privileges, even though I had a perfect record, no marks on my record. And then the lawyers went back and forth. I went back to the judge, and the lawyer for the wife told me I had the green light. So we sent the nurse to the hospital. She's greeted by the police, and she's turned away. And then that hospital ended up turning me into the medical board for sending the nurse because they said I did not have privileges. But anyway, back to the event. So that third event was that the hospital said they were denying my privileges. So I sent an email to my patients saying that going forward, I was going to prioritize the unvaccinated, that I was not going to be taking new patients who were vaccinated, with the caveat that I would never turn away somebody with a life-threatening event, and I would never turn away an established patient. And I actually never held this up. I was just trying to make a statement. But that really enraged Houston Methodist. And the responses I got to that email were, for the most part, very positive. And I posted them on X, and I posted the same tweet 25 times. It just said vaccine mandates are wrong. And then I put a screenshot of one of the positive responses I got. So that was 25 tweets in one day with the same message. A few days later, I find out that my hospital privileges have been suspended, and Houston Methodist is calling me dangerous. So, I am still fighting both the medical board and Houston Methodist Hospital. I actually have a hearing with Houston Methodist next week. I sued them for defamation. I lost. I appealed. I lost the appeal. And now they are suing me. I paid them, I can't remember the exact amount, but I think it was like $165,000. That was the damages because I sued them and lost. And now they want interest on that, which we are arguing that we don't owe interest because we had reached an agreement and that I had signed. I sent the check, they cashed the check, and now they're reneging on the deal. So anyway, they're suing me, and I'm going to court next week with Houston Methodist Hospital. And then the medical board, that has been a almost 4 year saga. They proposed a settlement that I pay them $5,000, that I retake the jurisprudence exam, which is a legal exam all doctors have to take, and then take an additional 8 hours of CME. And I refused that offer. And then so it went to the State Office of Administrative Hearings. I lost that. They said that I acted unprofessionally by sending the nurse to the hospital without having privileges there, that I endangered patient care by sending that nurse there. And now the judges have ruled, and now it goes back to the Texas Medical Board for them to decide what to do next. But my next move will be to appeal it further. So it will actually go to the state district court. And then I also intend on suing the medical board for violating my due process rights.
Wow. Good for you. Having the courage and the temerity to stand up to that entire system. I'd like you to go in a slightly different direction now, because you save patients' lives, and that doesn't seem to matter today in the larger medical paradigm. Obeying protocols, even if those protocols are irresponsible, like synthetic hormone replacement therapy for women with a 10% to 13% adverse effect, including breast cancer, ovarian cancer, colorectal cancer, stroke, and dementia. That means 1.3 million American women are sacrificed in their health, including death, because Big Pharma controls it all. And by the way, I debated the Surgeon General on PBS on national television for an hour. And you talk about someone who was out of the loop on what to do. And it was embarrassing. I chose not to make it a blood sport, so I tried to support her as much as I can, but you ought to download if you want to see that. Orthodox medicine is the number one cause or number three cause. AMA says number three cause. I say it's the number one cause, and I have the evidence to back it up. I did a best-selling book called Death by Medicine and a documentary. That Orthodox medicine causes more injuries than any other form of injury, and it causes more death. The AMA left out infections that people die from in hospitals, malnutrition. In 1 year, 5,000 patients died from malnutrition that occurred while in hospital care. And also, their figures stop when a person leaves the hospital. So if you were taking medicines at home for a condition and you die, they don't count those figures. Also, they did not include bed sores leading to amputations in their statistics. So their figures were grossly off. I give you that because the average American doesn't know any of this. They're going to follow whatever their doctor tells them. So I would like for you to take us on a journey now about what you've learned about the overall medical establishment and its bureaucracy up till now. I've had many conventional doctors on my show who had personal epiphanies about a darker side to their profession, but only after they were attacked. I remember someone sent me over a video clip, and it showed about 15 more or less doctors and their coats who didn't know each other outside of the Supreme Court, talking about how what was being done for COVID was wrong. They had other choices. These were all Orthodox. They were all attacked. Several appeared on the front page of the New York Times as the deadly 12 or the dangerous 12 people. Peter McCullough, the most cited cardiologist, nephrologist in history, over 1,000 citations on PubMed, was one of those people. He was also board certified in cardiology. He also had a background in epidemiology. He was a professor. All of that was taken away from him, and he was vilified. Now, you see him all the time promoting natural and non-toxic ways of dealing with health practices. Historically, I would have debated him on the practice of how you would get rid of AFib, because I've helped people get rid of AFib. You may or may not know, but I'm a registered dietitian. I'm a clinical board certified nutritionist. I have a doctorate in human nutrition and public health science with multiple backgrounds, and a senior research fellow at the Institute of Applied Biology and head of the anti-aging division for 36 years, and published, I'm approaching almost 1,000 papers. And I've seen an awful lot of people and helped them. And none of the people I counseled who have turbo cancer have died, nor the self-organizing nanoparticles have died. We have protocols to reverse them. But now I'm seeing one group of physicians who were as orthodox as you can get, but believed in freedom of speech and believed in being the 12th person. I don't know if you're aware of the 12th person argument. If 9 scientists or physicians say, we believe this is to be true, it is the moral responsibility imperative of the 10th person to say, hold on. Let's first try to deconstruct our beliefs so we don't become a mindless consensus, a cult of orthodox dogma. And we've lost that 10th person ideology decades ago. So in your case, you were an orthodox doctor, and if you had any epiphanies, such as Peter McCullough, would you tell us now that journey from being thrown out, destroyed, nearly bankrupted by orthodox medicine, the very cathedral that you went to work in every day, and now let us know what you've learned about the fundamental progenitor flaws in our medical system at the professional level. The forum is yours.
Well, one thing I remember from my training, and it was literally, I think it was the next to the last day of my residency, and that was a 5-year program. I was a Stanford, and one of my attendings came into our little residence office and said, hey, when you're out there in the real world, don't be the first to prescribe a medication that comes on the market. So wait, see how it goes, make sure that it's as safe as the drug companies say it is. And it's crazy because that piece of advice just stuck with me. And I don't know that if I held on to it as much as I should have when I first got out of my training, because we were always being thrown new antibiotics, and a lot of those are no longer on the market, and I did use those. But when the COVID shot came along, that advice really stuck with me. Just wait and see and make sure, and just having an open mind about. I had an open mind about it. I didn't personally take it, but I didn't just automatically dismiss it. But I do feel like that's one of the fundamental problems in medicine today, is just not having an open mind. And one clear example of where I have pivoted my position is the idea that there's nothing you can do for a virus. I came into the pandemic with that mindset, and that is drummed into us because they don't want us to overprescribe antibiotics. So the tendency is to do nothing in most respiratory tract infections. Do nothing, wait and see. If it lingers or if it persists or worsens, then you intervene. And that's standard of care for medicine. And that was very wrong during the pandemic. So shifting my thinking on that early intervention in a virus really can make a huge difference. That was a wonderful lesson. I also learned about the fact that you don't, a low oxygen saturation is not as, may not be as life-threatening as we once thought, because we thought that if you go below 90, that's an emergency. And COVID was interesting because we called it happy hypoxia. People were tolerating much lower levels of oxygen than we thought possible. So the mistakes in the hospital, I believe, and at least early on, I have heard they corrected it as things went on, but just automatically intubating somebody just because their oxygen level couldn't stay above 90%. And then in terms of just the whole system of medicine, I mean, yes, it was a slap in the face to be treated like that from my colleagues. And it wasn't just Methodist. You get on these little chat rooms with other doctors that you thought were, collegial, and just vicious attacks. I was on this Facebook group, Houston Women's Physicians Group, and it was like something out of Mean Girls, where they just really going after me just because I was doing things a little bit differently. It's very discouraging, but maybe the pandemic will change some things. There's certainly more doctors have come around, and I do think you look at the uptake of the COVID shot amongst doctors, it's very low, which tells you a lot. The doctors, for the most part, the majority of doctors are not following the CDC's recommendations. They're not as vocal as I'd like them to be, but I do think there are more doctors that have come around than we realize.
In January, you published a paper with Dr. Peter McCullough in the journal Science, Public Health, and Law about the mounting evidence that the COVID vaccines failed to meet fundamental safety and efficacy standards. Of course, therefore, it's not surprising we're witnessing enormous rates of injury and in excess deaths. Increasingly, nations' health ministries are reevaluating the RNA vaccines and recommending they be removed from the market. Japan recently gave a scathing analysis of the shots contributing to cancer, including turbo cancers. Everything we were told about these vaccines when they were rolled out, such as reduction in transmission, severity of infection, has been found to be false. As a result, thousands of articles are being retracted. And aside from myocarditis and pericarditis, where are we now in terms of confirming the RNA vaccine's other life-threatening adverse effects? And can you speak about the most recent evidence that understanding about the rise in turbo cancers, which I just filmed, and I don't think you've been sent the film, The Corruption of Science. Have you been sent Corruption of Science by Richard Gale?
No.
You will be today. You also received 4 white papers that I believe are as important as Daniel Ellsberg's Pentagon papers when he took material from the Rand Corporation to show the truth that had been hidden about our real role in Vietnam. Well, I got papers, documents, times, and specific laws violated, from AIDS to the 2 biggest to COVID, and Anthony Fauci being responsible. And it makes it a lot easier for you as a physician or as a scientist to say, gee whiz, on this date, they did this. Here's the proof of it. Here's the patent. Here's who the patent's name was in. How do you have a drug to treat a disease that is patented before you have a disease? So I've done some stuff that really makes it easy to push back against all this corruption. It's a 4-part series. You'll receive all that today. So take us on your journey, because now the world's leading oncologist, University of London, Professor Emeritus in vaccinology, epidemiology, and also in immunology. And oncology, published over 500 papers in the peer-reviewed literature on cancer, says that for the first time, he's seeing cancers that we've never seen in the history of cancer. Pancreatic cancer, colorectal cancer in young kids. We're seeing turbo cancers coming from people that were in remission 10, 20 years ago, and now they're coming back. We're seeing people who can develop a symptom on Monday and be dead on Friday. I personally had a physician, regular Orthodox physician's wife, who's a nurse, had an inflamed breast on Monday, and I said, immediately go in and get that checked. And they had stage 4 breast cancer in her on Friday. I intervened. Today, she is cancer-free. And by the way, the very first studies that I found at the beginning of COVID on successful treatment was at the Wuhan hospital, not the virus center, where they were using 24,000 milligrams a day in intravenous vitamin drips per day. No one died. And that information was never shared throughout our medical community. So in any case, take us now on that journey about what you're seeing now, including the latest study that just came out yesterday there could be as much as a 37% of your life is ended early if you took the vaccines.
Wow, I did not see that study. That's awful. But yeah, I continue to see people injured from the shots almost daily in my clinic. I don't see a lot of cancer patients. I have had a lot of people asking me to treat them for cancer, but I have deferred that for now just because my clinic is already very full and I'm not an oncologist, and we do have somebody in Houston who is managing patients with alternative medications that I refer to. But I have a good friend who works at MD Anderson. She said she's never seen anything like it in terms of young people getting very advanced cancers. One thing that's concerned me is the CDC is in charge of sharing cancer data, and the cancer data that they have shared, which, you know, if you're not careful to look at this, it's projected numbers based on 2022. So according to the CDC, everything's okay, but they're not giving us the actual data. They're giving us projected numbers based on 2022 data. So it will be interesting to see what happens when that actual data comes out. And I do understand there have been recent papers showing an explosion in cancer, despite not having the CDC actual data to help us with that.
Do you have any updates on what is now the most recommended course of treatment if you come down with COVID, since COVID is still being promoted by the CDC and the FDA and the governor of New York, and as if none of the 3,500 articles showing that everything about COVID was wrong, they're just wiping it all away and saying, safe and effective. Kids could take it. Your thoughts?
Yeah, I still see patients with COVID. I don't worry about them though. There was a time when I did worry about them. I gave my cell phone out to a lot of people during the pandemic. But I don't ever worry, even people that are elderly, I just don't worry anymore. But if people want treatment, then, ivermectin blocks the virus from entering the nucleus. It has 20 mechanisms of action. It's anti-inflammatory and it's incredibly safe. So I usually start with that and recommend, vitamins, high dose vitamin C, make sure they're up on their vitamin D, irrigations of their nose and throat. But I would say, it really does act like a cold for the most part. Now, some people, it turns into bronchitis, but it's not like it once was where, I worry that if I don't intervene, they're going to end up in the hospital.
I'd like for you to take a few moments, if you would please, because we're coming up near the end of our program, and go through some of the now almost laughable standards that we were held to. I'll give you just 3. When you look at the size of the virus, all of the masks, every single one, you could have 1,000 viruses go right through that mask. They were functionally useless. 2, at a high school, athletes, young, healthy athletes, were told to wear the mask. One of the teachers put a little emergency monitor in the masks to see when a student had lack of oxygen therapy. Within 16 seconds, the alarm went off in all the masks. Now imagine wearing that mask all day, including for several hours when you're engaging in sports activity. Think of the neurological damage that is going to be present in them as they grow older. A separate study showed carbon dioxide buildup in the masks. It took 15 seconds to build up an unsafe level of carbon dioxide in the masks. We were told that you must mask, but only with some exceptions. For example, you could go into a liquor store, but not a gym. You could go into a restaurant and you must wear your mask until you sit down. The moment you sit down, you can take your mask off because obviously you're free of being affected by the virus. But everyone serving you must wear a mask, from the chef in the kitchen to the maitre d'. But you were safe. When you finished your meal, suddenly the virus would recognize that you are its target, and you had to immediately put your mask back on. We were never told about shedding, and a lot of people who did not get the vaccine came down with COVID. We were told that the deltoid muscle in the arm would hold the virus, would hold the vaccine and the production of the spike protein for about 24 hours, then gone. Not true. The latest study showed people still were manufacturing 700 days later. For those who know anything about immunology, we are a nation bereft with about 130 million cases of people with autoimmune conditions. Now, during the studies, at the beginning of the research, they excluded anyone with an autoimmune condition. If you had cancer, if you had diabetes, if you had heart disease, if you had arthritis, lupus, erythematosus, you were not allowed in the study. The moment the study was over, you were allowed to take it. In fact, you were mandated to take it. That's not just bad science. That is utterly corrupt science. So the people that are not a part of your study to show safety and efficacy are excluded until it's time to market it, and then they can have it. We have seen vials proven to have billions of human DNA. I suggest anyone who wants to know why this is important to go back and look at Baltimore's Nobel Prize winning research on jumping genes. We also had, as one more example, Kary Mullis, who won the Nobel Prize in Science for discovering the PCR, and he was a close professional friend of mine. In fact, 15 million people downloaded an interview I filmed him with, an hour and 54 minutes, in 1996. And he said, "Don't use my test to make diagnosis. It's merely an amplifier. And above a small number of amplifications, you're just looking at cellular debris." The amplification was 41 amplifications. Even Fauci said above 26 is just garbage. So all of the people who tested positive, which was the majority of people, and told that they had COVID, these people had false diagnosis. And you would have thought that with all the so-called best and brightest scientists we had, they would have said, we need a better test to determine if you're infected or not. When I started seeing the attacks upon ivermectin, and all with one voice, with my long experience as an investigative journalist, I decided to look for the truth. So I went only to the peer-reviewed literature on ivermectin and hydroxychloroquine. I found hundreds of studies. So I made a chart and I published it. Here's the number of hospitals or research centers. Here's the number of scientists involved. Here's the number of patients involved. And here is the percentage of those who were infected, took these medications, and did not end up with COVID symptoms or hospitalization or death. And the biggest statistic was the low mortality rate if you took it within the first week. And so I sent this out. So now we had proof, hard proof. You say it's horse dewormer, shouldn't be used by humans. There's no science backing it up. You're going after the man who's the head of immunology, professor over at Yale University. You have a petition by other professors to have him removed from the faculty, thrown out of the school. And he sits on at least 6 editorial boards of prestigious science, and you're not even giving him an opportunity to speak. So much for the wisdom of higher education. I sent it to every member of Congress. I sent it to every major media in the United States. Not a single person responded. that COVID was able to be stopped and the person protected with just those two drugs. And there was the science to back it up, yet nothing was done. Your thoughts, please.
Yeah, I agree. I mean, I believe it was orchestrated. I believe that they denigrated ivermectin to force people or to influence people to get the COVID shots. Because if you look at the timing of it all, it really coincides that FDA put out their infamous horse tweet in late August of 2021, and a couple weeks later, Biden mandated the COVID shots. So I don't think it was. I think it was very planned and part of the strategy to get a shot in every arm. I would like to see the FDA correct that. I did sue them over that, and we won, and the FDA was forced to take down the horse tweet and take down their misinformation on their website regarding ivermectin. But I think that the FDA needs to rebrand ivermectin. They need to make a press release about the safety and efficacy of ivermectin. And then I think they need to make ivermectin over the counter. It's become a black market drug. I still encounter issues trying to get it filled for my patients. Even last week, I had a pharmacist say, "Well, we just don't do that. We don't dispense ivermectin for COVID." It's really not the pharmacist's decision. It's the doctor and the patient's decision. So we're still encountering, and this is in Texas, still encountering problems. There are 5 states that have ivermectin over the counter, and Texas was the most recent. But I anticipate that until the FDA really comes out and makes a statement and makes it over the counter for the country, that we're even in these 5 states, it's going to be more difficult to access than it should. I actually did a poll on X, and I said, "Where do you get your ivermectin?" About 25,000 people responded. 52% of people are getting their ivermectin from the feed store. And then the second highest number was from overseas, another country. It's just absolutely ridiculous. It's such a safe medication. It's safer than Tylenol. It's safer than Advil, which are easily available over the counter. I really wish the FDA would act on this.
And I wish the FDA and the CDC would be abolished completely and start from scratch, bringing in people who are qualified in their field but have no financial or ideological association with any special group, including Big Pharma. And if we don't do that, then we're going to end up with a continuation of corruption. Dr. Mary Talley Bowden, thank you very much for your good work. And anyone who would like to see what she's doing to support her efforts, and I suggest that they put together a GoFundMe for her. Her website is Breathe, BREATHE, MD.org. Nice to have you on today.
Thank you so much, Gary.
And I want to thank all of you. This is our 46th year without a stop broadcasting the Progressive Commentary Hour. And my first radio show, by the way, was on January 6th, 1967. So we've been on the air a long time, and we intend to stay fighting on behalf of the truth and going to challenge all the things that we have been indoctrinated into believing that, unfortunately, well-intentioned good people have been inundated with the wrong information. We shouldn't have to have my guest end up going broke and discredited when history will show that she was correct, she's on the right side of these issues, and so let's do what we can to help her. Share this video. Share it with as many people as you can, because with the algorithms of Facebook and Google, they're not allowing any good information to get out there. And let's support Robert Kennedy, because they're going after him with everything they can. And now I think they've got the president also challenging him, as he just did. So who knows how long he'll be able to continue to make changes. I look forward to sharing more on our next program. And you can go to Gary Null YouTube and see thousands for free of videos on either the Classrooms on the Air, one topic, in-depth, health classics, non-controversial, or my health nutrition updates, which I only use the National Library of Medicine and share that with you every day. All right? Have a nice day, everyone.